Now to a Verify segment. It's about a disease you've heard a lot about, but you probably don't know just how much it affects East Texans: diabetes. The disease affects more than 23 million Americans every year, and it is the 7th leading cause of death.
Yeah, in East Texas, doctors call it an epidemic. We verified the price of commonly used medications have increased between 70 and 1,200%. That's just in the last 4 years.
So what's going on? CBS 19's Taylor DeHaze is here to verify the facts about these drastic price increases.
Brian, Tashara, looking at insulin prices, the average price hike came out to 107%, and that's only for a 4-year time span. Now, families I spoke with say they've had to pick up extra jobs. One husband returning to the oil field 3 weeks of every month, all to make his family's life livable.
We have a loud, crazy, fun family, homeschool, and do diabetes 24/7.
Sarah Wilson is the mother of 4 living in Van. 3 of her children have type 1 diabetes. Her daughter Hope, her son Eli, and Faith, who was diagnosed at 9 months old.
I had panic attacks all the time. I would run screaming like to her bedside in the middle of the night, hold my breath, like watching to make sure she was still alive. Like I would just wake up in a panic.
Wilson and her husband made the decision to apply for a service dog, scared for their daughter's life because they say her treatment was too demanding to keep up with on their own.
And the fact that they are going strong 6 years later is pretty remarkable.
Wilson says Faith is the youngest person in the country to have a service dog, and having this life-saving pup has been a gift from God. The dog can sense when a child has a blood sugar spike, no matter when.
She would grab the stick, and then she would take me and touch with her nose whichever girl's blood sugar was out of range. And if both of them were out of range at the time, she'd touch one and touch the other.
But the Wilsons say it's not the burden of keeping her children healthy.
This is crazy expensive.
It's the toll on their wallet that's keeping them up at night. Mr. Wilson just returned to the oil field, only seeing his family 1 week every month.
We don't want a handout. We just want to be able to afford it. We don't want it to be such ridiculous costs that we can't afford it. We are willing to pay. We're willing to work. We've made sacrifices.
All to keep food on the table and insulin in full supply.
Just a few years ago, I could decide what insulin works better for her.
Faith is also allergic to a certain type of insulin, the only one the Wilsons say they can easily get prescribed.
We have to jump through fiery hoops every time we have to go get an insulin prescription, but her doctor has written letters, and we've, got documentation showing that she's had allergic reactions since she was 15 months old.
But she says all they can do is pray and pay.
Rather than us not feed the children this week, we chose to borrow from friends who we've shared with before.
Insane and obscene.
That's how Dr. Christine Bratcher describes the rising cost of medicine, particularly insulin. Working as an endocrinologist in Tyler, she says diabetes is an epidemic in East Texas.
I think the problem in East Texas is that the burden of the disease is more. And you're going to have that any time that you have lower socioeconomic class, so poorer people or less educated people.
And while bigger may be better, not in terms of belt size.
Where obesity goes, diabetes is going to follow.
In East Texas, 1 in 10 have diabetes. Dr. Bratcher says what's more alarming is 1 in 20 have it but don't know it. Looking at the demographics, she says race plays a role.
It's much more common in Hispanics. It's actually much more common in African Americans and also, of course, Native Americans.
Overall, she says those getting diagnosed with the disease are getting younger and younger each year.
So now it's very common for me to see patients in their 30s and 40s developing type 2 diabetes instead of in their 50s and 60s.
Despite the closing age gap, she says those over the age of 65, specifically Medicare patients, are forking the biggest bill.
I watch now what I buy at the grocery store because I know I need this. This is life-saving to me. Without this, I wouldn't be here.
Gary Fletcher is a type 2 diabetic and has been for 16 years. Like the Wilsons, Gary says he can only take a certain type of insulin without having an allergic reaction.
That's a big problem.
His wife Nancy described a recent visit to the doctor where they did not have Lantus, Gary's insulin of choice.
He said, I cannot take that. They said, I'm sorry, this is what we have. You won't be allergic to this. It's the same thing as Lantus. He took it, and guess what?
he had an allergic reaction.
He said, well, if you ever have to go to the hospital again, please bring your Lantus with you. Now, isn't that something?
Bringing your own medication to the doctor, that is what they told you.
If you have to go to the hospital, you bring your Lantus with you because you can't take anything else.
The Fletchers,
Oh, here's another one for the drugstore.
oftentimes couponing to make ends meet, say Medicare does not cover Lantus anymore, and they're paying the price.
Of course, our insurance company goes right along with the guidelines of Medicare.
Lantus is just one of hundreds of brand name drugs to have a dramatic price hike since 2012. We verified the per unit price of Lantus is $23.93 compared to $11.98 in 2012.
I get 2 bottles of this a month. 6 years ago, I was paying less than $50 a month. I'm now paying over $250 a month for the same product, using the same units I've always used for the last 16 years.
Here's what we can verify. Lantus went up 100%. The highest spike was in Apidra, increasing 171%, and the lowest, Novolog, increasing 89%. We also verified how these prices are tracked. First, by the Center for Medicare and Medicaid Services. The prices are then reported as the National Drug Acquisition Cost, basically what a pharmacy pays for the drugs.
It's really difficult as a small business owner to manage these price fluctuations.
Brad Martin is a pharmacist at Kenzie's Pharmacy in Tyler. He says Medicare patients like the Fletchers are hit the hardest
$900 Victoza,
by these rising drug costs.
$450 for Lantus. Especially our Medicare patients, they get into what's called the coverage gap or donut hole. For 6 months out of the year, they're just paying copays, then all of a sudden they get into their coverage gap and they realize that these medications are very expensive.
As a local business owner, he says he takes a hit on these hikes because of insurance companies.
There's usually a pretty good lag. If the price goes up on a drug, the insurance companies can wait weeks to months to raise what they pay, so we could actually be losing hundreds of dollars.
It's a mess. It's a complete mess.
Dr. David Belk with TrueCostOfHealthcare.net gained an interest in drug pricing after a pharmacy tech once explained that patients spend more than needed on drugs with their insurance than sometimes just paying out of pocket.
Since I've been looking at the prices, every single year, nearly every brand name medication I've tracked has gone up 10 to 20% on average, sometimes as much as 80 to 90%. And remember, these drugs were expensive to begin with.
We verified this for you. For the 400 drugs he's been tracking over the past 4 years, he's seen an average rate of inflation of about 70 to 75%.
And so the 3 major players who are aware of this and can do anything about it, the pharmaceutical companies, the FDA, and Congress, are all far too happy with this arrangement than to want to change it.
Dr. Belcher tells me doctors are prescribing older insulins because newer ones are not affordable.
It just is a devastating feeling to not be able to use the newer drugs that would actually help people with weight loss and hunger. And we have to revert to the older drugs that do the opposite. So we kind of fight ourselves.
Families can take care of their children the best way possible. I would plead with them to care. What they're really affecting in my world is the amount of times I have to pierce my child's flesh.
Right now, the American Diabetes Association has a petition that you can sign to make insulin more affordable. The link to that petition is on our website at cbs19.tv, and there you can also find a detailed breakdown on the rising cost of insulin and hundreds of other drugs that may have you pinching pennies. For now, Taylor DeHaze, CBS 19.
All right, thank you, Taylor. Well, it is time to